Sure.
Alrighty, sir. So you're here just for your routine physical, is that correct?
Well, yeah, just a checkup, I guess, for the year, whatever I rate.
Okay.
You know, I had some blood labs drawn.
Yes, sir. So we did, we got a lot of blood drawn, and so we'll go over all those results, and then we'll do the physical, which will just be kind of a routine head-to-toe physical. Okay. So just kind of give you a warning. You're only 44, so you don't require a prostate exam. Okay. So you can wipe around with that one, unless you've had previous problems or anything like that in the past. Okay. Yep. So now to your 50.
Okay.
Okay. Any concerns at all today, anybody?
No, I just want to know about hormone levels. I mean, what do you expect for changes and stuff?
Oh, well, that's really hard to say. Every man is different. I mean, obviously, as you get older, the testosterone levels could decrease. Okay. But then I can't say that for every patient, because you'll have one gentleman come in at 50 and his hormone levels are the same as a 22-year-old. Okay. So once again, you can't expect them to start, slowly dropping down a little bit. Okay. But once again, it's not every patient does not follow that textbook statement. So that's kind of a loaded question. So hopefully I gave you a loaded answer.
No, that's exactly.
Alrighty, sir. So let's go over your results. And so you just had the routine fasting labs, is that correct?
Yes, ma'am.
Okay, so we got what's called a comprehensive metabolic panel on you, okay, which evaluates your liver function, your kidney function, and both your liver and kidney are functioning properly. Okay. We checked your electrolytes. Everything's balanced, no abnormalities for your electrolytes. We checked your fasting sugar levels. You're 85. Anything over 100 is considered elevated, so you're well within normal ranges. No concern for diabetes whatsoever. Okay. We also just reflexively get what's called a hemoglobin A1C, which gives us a 3-month window of how your fasting sugar levels have been. More important for those who we suspect may be diabetics, but once again, kind of a reflex test that we get. And you were at 4.9, which is once again very well within normal range. Okay, so no concern whatsoever.
Okay.
We checked your cholesterol levels. So you are at 155. And anything over 200 is considered elevated, okay? So for total cholesterol, normal range.
Okay. Your
bad cholesterol is at 86. We typically don't want to see that over 120, okay? So once again, normal range for you. Very good number, actually.
I don't. That's the thing. I don't. My life. I mean, I don't eat excessive food all the time.
Okay.
I include olive oil in my diet. Lots of water. I drink lots of water.
Very good.
I incorporated in my diet, so I don't drink soda waters, or I don't drink excessive amount of alcohol through the week and stuff. I work out every day.
Okay.
I just
well, it's definitely reflecting in these numbers that you're taking the right steps to maintain a healthy, not just external but internal.
Sure.
Okay. So only number that is a little bit concerning are your triglyceride levels. Okay. So your triglycerides are slightly high. So anything over 150 is elevated, and you're 182. Okay. Typically we see elevations in those triglycerides if more so in those persons who have like the high sugar diets, okay, or eat some of the sugars or the carbs. So in saying that, if you do work out, do you tend to carb load a lot prior to working out?
That's the thing. I started. A while back. I was drinking those shakes, and that was a lot. So I just got rid of that and just eat natural sources of carbohydrates.
Okay. So that may be due why it's slightly elevated now. So I would definitely recommend, about 6 months, we just repeat your lipid levels to make sure that that's trending down. Okay. And once again, that's where we see it mostly from carbs, that triglyceride level. Okay. And so with you, the only thing that I can really think to ask is, once again, are you carb loading prior to, workout? So, and if so, that could be what's causing that minor spike. Nothing we would start medication therapy for. Okay.
Yeah. Okay.
Lifestyle modifications is what I would direct you to do.
Great, doc. I was just concerned. That's probably what it is, because typically, like I'll eat. I guess if I had eliminated the night before my carbs and before, then I would probably be different.
Yeah, there's potential too. So once again, who knows? Once again, were you carb loading that day for for run or whatever the case may be? But yes, that could have definitely caused a spike. Okay? And lastly, too, so your good cholesterol level. So your good cholesterol is at 33. All right. We typically want it to be about at 40. So that's the number that we actually want to go up. Okay. So that's the one number in your cholesterol we want higher, because that's the good cholesterol is what goes back and cleans up all the plaques that the bad cholesterol lays down. Okay. And so typically if you eat some of those good fats such as avocado and salmon, you can increase that number. And you can definitely go online and find additional foods, so I don't know off the top of my head, to help raise that number, okay?
Okay.
So once again, just off the top of my head, avocados and salmon.
And salmon, okay.
Yeah.
Very expensive diet, but I guess it's worth it.
Right.
Salmon's good.
Okay. So we also looked at your urine, okay? So we did not see any type of blood, no protein, and no bacteria, and no glucose in your urine. And that's typically the things we focus in on, okay? And so it's a clean catch, no abnormalities. We also took a look at your thyroid stimulating hormone, which gives us, lets us know, are you hypo or hyperthyroid, and you were well within normal ranges, okay? And lastly, we took a look at your red blood count and your white blood count. Red blood count was normal, not anemic or anything like that. We saw one number on your white count, your monocytes, which was just a smidge elevated. And if you're battling a little cold or maybe some allergies, we could see that. But once again, nothing that's telling me full-blown infection or anything like that. It's just that one number, very minimally elevated. And only reason I talk about it is because if we send you your results, you're like, oh, doctor didn't go over this with me. So,
No, yeah.
Yeah.
Exactly.
So nothing to be concerned about at all.
All right.
Once again, typically I wouldn't even say anything about it. But,
No, I mean, that's good to know. I mean.
All right. And see, yeah, there you go. A little bit congested. So.
Yeah, this morning I woke up. I don't know. Well, see, because my girlfriend she incorporated this new cat into her life now. She had a dog, now she's got a cat. And so I noticed when I went over there last night, I was like teary-eyed, and I was like, I don't know. And I told her, I said, look, you want me to be next to you, close to you, or do you want me to be away from you?
Right.
And so I said, what's up to you? You know, I want to let you know that I won't be coming around as much as you expect me to, because I'm allergic to cats.
Definitely. So you already knew you were
allergic to cats. Okay. Yeah, I don't like cats.
Have you been taking like any Zyrtec or anything?
I take when I need it. I'll take the Zyrtec over the counter or a Benadryl.
Yeah.
If it gets that teary eyes, I tear a lot, and a runny nose.
I get the. So. Yeah, well, if you have to, maybe pre-treat prior, maybe a couple of hours before going over there and see if that helps. Yeah. But and that's just from a couple of hours over there. She might have to rethink that.
Yeah.
Alrighty. So, do you want to go ahead and have a seat on the table for me? Any questions about any of those lab results at all?
No. I'm just curious at the age of 44. What we should do as far as getting up, helping us make that letter at 50.
So far, you're definitely on the right track. So, we'll go ahead and do the physical, and then we can talk more in depth about it. Okay. All right. And I always like to start with heart and lungs.
You want me to just remove it?
Let me see how it sounds with it. No, you're dead. Big deep breath for me. Exhale. Very good. And big deep breath. And exhale. Very good. If you could, just tilt your chin upward for me. I'm just going to look to your carotids. Alright, just look forward to me. Do you wear glasses or contact lenses at all?
No, I don't.
Very good, lucky you. Any LASIK in the past?
No.
You just have good vision.
Well, I did see, there was, I guess because I was in the military, I did see she said there's some astigmatism, but like from being out in the sun all the time in the military.
Right.
I got brown spots in my eyes,
Okay.
but it hasn't bothered me. She says it's just part of not wearing glasses when you're supposed to wear sunglasses out in the
Okay.
sun. So.
And she said behind your eyes?
No,
or-
inside on the lens you can see.
Okay. Oh, so the pterygium. Okay, got it. So
Yeah, so-
not stigmatism. So a little
Is
bit
it, I
different.
don't understand,
Okay.
but it's
Yes,
the
yes,
brown.
yes. No, I see it.
No.
Yep, right here on the white portion.
Yeah.
Yep. So you have what's called a little pterygium.
Okay.
So typically it stays right on the white part, but it can start over time. Can definitely progress over to the actual lens.
Okay.
And then when it does that, it's called a pinguicula. And if it does that, then we definitely consider sending you to maybe ophthalmology to have them remove it because it could affect the vision. But right now, still well within the white part.
She told me to wear glasses, sunglasses. So.
Yeah, and typically, a lot of military persons, especially if you deployed multiple times overseas.
No, I just did a lot of training. I did a lot of training in
Okay.
the sun. I was in the desert,
yeah.
training in Palms.
So, oh yeah.
in the hot
So,
sun.
yeah, we definitely saw I just came up back to G, so yes,
Okay.
we saw a whole lot.
Yeah.
So, all right. So if you could just look for me, just follow this with your eyes only, okay? Okay. Any pain other than maybe crossing your eyes?
No,
Okay.
no.
Good deal. Open up real big for y'all for me.
Ah.
Okay. And when was your last dental appointment?
God, it's been a while to tell you. I mean, I have the benefits to go. I didn't need to go. You guys any recommendation of where I need to go?
Honestly, I don't. I'm a little bit too new to the area.
Okay.
All I can say is definitely if you find a dentist, make sure they're well established and not a new location. Not saying a new location is not great, but they're gonna charge you out the wazoo because they're new.
Yeah, sure.
And they're trying to basically pay for
Okay.
all of them. So
Yeah.
this is probably the only recommendation I have as far as finding a dentist. I have no idea other than ones the military sent me to. I don't know if they were that great. So
No, that's understandable.
yeah. All right, check out your ears. Well, yeah, every
My
6
ears might
months
be dirty.
you should be getting your teeth checked. No, they're actually super clean.
Really?
Yeah, very clean.
I was
You might
I
feel
was
it.
in the attic working it last night.
Any itchy ears at all with these allergies?
No.
Good to go.
Typically, I usually clean them with a little bit of peroxide and stool softener.
Yeah.
And clean them out.
Okay. Yeah, no, they're super clean.
Okay.
Not a drop of wax in them. Okay, so you're doing the right thing.
Okay.
All right, and can you hear this?
Yes.
And can you hear this?
Yes.
Okay. Any changes in your hearing at all since
No.
your last
No.
audiology check at all? Okay. All right, just gonna press on those sinuses. Okay. Let me know if you have any pain, discomfort when I'm pressing. Okay. Can you open your jaw for me and close it? Very good. Can you relax? Just tilt your chin down for me. And tilt it back up. Okay. And lastly, any pain, discomfort when I press on those sinuses?
Yeah.
Okay, I'm just going to check your thyroid real quick. Okay, can you go ahead and swallow for me? Good. I know it's difficult. I'm like, it's on your neck. You're like, oh. Okay, go ahead and stretch your legs all the way out. Okay, go ahead and lean back for me. Okay, I'm just going to listen to your abdomen. So if you put your hands down to your side, please.
All my junk in here.
Any issues with, let me know at any point if you have any pain, discomfort, okay? Any issues with bowel movements or urination at all?
No, ma'am. No dark stools, anything like that.
Good deal. And you said minimal alcohol intake?
Very minimal.
And if you could, sorry, I know this is a little bit uncomfortable, just go ahead and look forward for me, like you're on the front crunch. Okay, good, and relax. I'm just checking my hernia. All right, go ahead and sit up for me. Okay, I'm tapping those kidneys. Let me know if you have pain, discomfort. Pain, discomfort over that kidney at all?
No, ma'am.
And pain, discomfort over that
No,
kidney?
ma'am.
Very good. All right, so next what we're going to do is we're going to do a little mini musculoskeletal exam and test your muscle strength and your range of motion, okay? So if you could, just shrug your shoulders upward for me and relax them down. Very good. Then you put your arms up like so. Don't let me pull your arms down. Push forward against my hands. Perfect. Push out with your elbows. And then push down. Very good. And then the arms down to the side. Wrist up. Okay. Wrist up for me. And push up against my hands with your wrist. Okay. Push up. Keep them up for me. Push down with your wrist. Good. Push out with your wrist. No. Because I'm testing each leg.